Let's take you back to Gaza now. There's been fierce fighting around Khan Yunis, the IDF saying they have encircled the city in the south of Gaza. But also we understand there is fighting around some of the hospitals there that are there. So let's take you to Gaza. We can speak to Leo Kantz, who is the head of mission for Palestine with the MSF, also known as Doctors Without Borders. It's very good to see you, Leo. Thank you for joining us. Can you tell us where you are, firstly?
I just arrived in Cairo yesterday, and I was in Gaza for the last 2 weeks.
Were you in Khan Yunis?
Yes, we were in the west. We are living in the west side of Khan Yunis, and I went to visit the Nasser hospital and the European hospital as well.
What was the situation in those hospitals? And Leo, what was happening around them? Was there fighting around the hospitals?
It's catastrophic. You know, I just went there just a week ago, and it was already fighting quite close to the hospital. When I was there was a bomb who fell down just 150 meters away from the hospital. It killed 2 boys, 4 years old and 5 years old, plus six more people, and 80 wounded. So already when I was there a week ago, the fighting was quite close. Since a few days, it's becoming increasingly close in the immediate vicinity. I just talked with my team this morning. They are very scared about what is going on. They don't know where the troops are. They hear a lot of shooting and bombing. They are so scared to get out of the hospitals because they are scared of being shot at, like it happened in Shifa hospital in the north, like in Indonesian hospital in the north as well. They are really terrorized by what's happening. And we can see that currently the Israeli military is on purpose terrorizing the healthcare worker. It is not acceptable. They had to bury bodies inside the hospital because they were too scared to go to the cemetery that is just 100 meters away from the hospital.
And what is happening in terms of treating people inside the hospital? What is needed there? How overcrowded is it? What do you have in terms of equipment?
So, you know, it was already overcrowded when I get there. People everywhere, IDPs everywhere, way too many patients for the number of healthcare workers. So many patients were just laying on their beds for days, for weeks without the proper medical care, because there are not enough staff. Currently, more than 70% of the staff has left Nasser because they are scared for their life. And this is not acceptable what is going on. We are forced to abandon patients, to let patients die on their beds because the healthcare worker cannot stay in the hospital. It's happened in the north, it happens again in the south. Nasser Hospital and European Hospital are the last 2 hospitals that were functioning in the south. Now Nasser is barely functioning anymore because there are no more staff and no more staff to take care of the patients. Patients are in critical condition. They need a lot of care, and we cannot give to them.
And
it's inhuman. It's going on. It's really inhuman.
Is any medical aid getting across the border to the Nasser hospital?
You know, we managed to get some medical aid across the border, but it's very difficult to bring it to the hospital. When I was there a week ago, we brought a full car of medical supply. So they have some medical supply to carry on, even if it's not enough, especially in terms of painkiller. But when you talk about the north of Gaza, which we tend to forget a bit, like Shifa hospital, like Indonesian hospital, there is no supply at all almost that can reach those areas. When I was there, I tried 4 times to go in North Gaza. 4 times we were denied by the Israeli army to reach this area. This is completely forbidden under international law to forbid humanitarian people to bring essential goods like medicines to the population. What is going on in Gaza now, it's too much. I hope we're not getting used to it. It's a massacre that is going on every day. I can remind you that since the beginning of the war, it's 25,000 people who got killed. If we just count the women and children, it's 15,000 women and children who got killed since the beginning of the war. It's 150 children and women being killed every single day since the beginning of the war. It is not a normal war. It is a war that is targeting civilians. When I was visiting Nasser Hospital and European Hospital, I was shocked, but truly shocked by the number of children and women inside the hospital. It was mainly women and children. I have never seen this in any other war. And I've been working in other wars. As MSF, we've been working in other wars. Mostly you see combatants and you see some civilian people. But here it's the opposite. You see mostly civilian people getting treated for very difficult wounds. The members are crushed, a lot of burns on the face, on the arms, legs, on the body. It's extremely difficult wounds to take care of, and it's shocking and outraging that so many civilians are being wounded and killed.
Leo Cairns, thank you very much for joining us, Head of Mission for Palestine with the MSF. Thank you.
Thank you.